So a little about IRD. IRD is a global health delivery and research organization that works across 15 countries globally. And the goal of IRD is to improve the access and quality of health services delivered to the under-resourced areas in both rural and urban communities. So IRD's flagship program, Sukoon Zindagi, translated as Peaceful Life, has been delivering innovative mental health care in communities and healthcare settings within Karachi, Pakistan since 2014. So Aneeta, could you tell us a bit about yourself and your role in IRD?
Sure, I'd be happy to. So IRD was founded in 2003. We are, as you said, a public health research and service delivery organization that is now operating in over 7 countries globally. And each country has their own office and their own teams. I am, as country director, I am leading the teams in Pakistan. My background is actually in anthropology and development. But I've always worked, my career has been in the development sector in Pakistan.
That's just great to know. So moving forward, Aneeta, what inspired you to start the mental health program in Interactive Research and Development Pakistan?
I've always had an interest in mental health. Prior to working at IRD, I was working in maternal health. Prior to that, I was working in sexual and reproductive health. For a couple of years each. And in both of those experiences, I always used to think about how often for a lot of people, especially women, mental health is such an underlying issue that is not talked about and is not really addressed, especially in a context like Pakistan. We know around us that there are hardly any services for the masses for mental health. Access is definitely an issue. There aren't enough mental health service providers. Costs are very high. There's a lack of awareness. So it was always something that I was interested in, would read about. When I started working at IRD, I was actually recruited for a different role. But IRD is a great organization in that there was always a space given to young people to come in and do things that were of interest to them. So IRD at the time that I joined in 2000 and I joined in 2012, but at that time we had a very large TB program. It was our flagship program and still is. And in that, it just sort of seemed like a very natural thing to do to sort of, think about the mental health of TB patients as a great starting point. And I remember thinking that, well, IRD is a public health organization. We have access to a lot of communities. We have access to a lot of people in various public health domains, such as TB, HIV, diabetes, and so on. So it would be a value add to bring on a mental health program. And so that's where it started.
That's just some amazing work. So, Aneeta, after starting the mental health program at IRD, describe what was the first year like?
Well, the first year was me and there was one more person, a research associate who was working with me. So it was just the two of us. There was a lot of reading up about what's happening globally, what are other groups doing in global mental health, what are the, best practices, what is applicable for Pakistan, what is not, what is the literature saying about community-based mental health programs. A lot of conversations, a lot of picking each other's brains, a lot of getting ideas and kind of sitting with them and seeing where they go. And then we decided to pilot and just start, so we spoke to a few technical advisors who advised us on the best tools to use. We had read a lot about it. And so we just decided to just go ahead and start. At some point you stop thinking and reading up, but you should just start. And so that's what we did. And as we stepped into the field and as we started working and as challenges would come up, we would, find solutions to them and try them out. Sometimes some worked, sometimes some didn't work. And we made our way through that. Through the pilot at least. We were very lucky because during, I think in our 9th or 10th month, we had applied for some grants. And we received seed funding from Grant Challenges Canada with a formal grant to actually start the program. So that is when in October of 2014, we expanded the team. It was just me and the RA, as I said, but we expanded the team. We got more people on, we hired community counselors. And that's when we really began to pour ourselves into it. A lot of, as I said, learning by doing, a lot of trial and error. And yeah, we just took one step at a time and jumped into it.
So Aneeta, could you tell us how is IRD changing the status quo in healthcare and mental health?
So over the last 6-7 years, we've done a number of key things. For one, we're one of the few organizations in Pakistan that has a complete comprehensive training manual developed for preparing community-based counselors to be able to provide frontline support for mild to moderate depression and anxiety. So we're able to build the capacity of large numbers of people, which is not happening at scale in Pakistan. So that's one thing that sets us apart. Most organizations tend to work with most corporations or companies might work with more white collar employees, whereas because of our work in community work and community development, we are naturally moving in a place where we are able to provide access to mental health services for blue collar workers, and as I said, people within communities. Um, in COVID, when COVID hit, we pivoted our program to be able to provide mental health and emotional support for COVID patients. And since COVID has started, we've called over 65,000 people. And this is when we call COVID patients as they're isolating in their homes. We check in on them every 2 days, see how they're doing, not only physically, but also mentally, because it can be a really difficult experience. It has normalized to a very large extent at this time in 2022. But when COVID hit, at that time, it was very new and the whole experience was very jarring to people, and obviously would induce a lot of anxiety and depression for the duration, at least, that people were in COVID. So again, reaching people at scale during the pandemic is something that we were doing very quickly at that time, and we still continue to do now. In partnership with a few other organizations in Karachi, we are one of the founding organizations for the Pakistan Mental Health Coalition. And the idea for that really is to come together to sort of advocate for mental health, provide services, do research, show impact, many facets to tackling something as large as mental health. So those are the key areas in which IRD's mental health program has made a mark.
That is super exciting. So Aneeta, how has IRD evolved over the last few years?
Oh, IRD has evolved tremendously. You know, we're a grants-based organization, and our real focus is on innovation and innovative public health ideas that can actually have long-term impact. So, and as I said, we're always open to new ideas and doing new things and seeing how they work. And then if models work, we're very interested in taking them to scale. So in the last few years, our funding has doubled. We have moved into new areas such as primary care, such as deworming, which again is something that in Pakistan nobody is doing, but we have one of the largest deworming programs in partnership with the government. So we've really been able to diversify the work that we're doing. We've expanded globally. As I said, we are a Pakistan origin company, but now we have offices in other countries in the world. So our growth has been phenomenal. We've got some very strong donors, some very strong partners, and an excellent team.
So on a more personal level, looking back at your journey, what are you most proud of?
I think that I'm just very proud of the mental health program, Pursukoon Zindagi. I'm proud of because I look at the journey of where we started and where we are today. So at that time, as I said, it was me and one other person who we together were making our way really. And now we've got a very large team of really young, dynamic, talented people who are part of the mental health program. We've got a very strong cadre of community-based counselors who are going out every day in communities and dealing with whatever comes their way. And so I'm just proud of that, the capacity that has been built and the learnings that we have accumulated. And so now we get requests from companies and from organizations, private sector, public sector, all asking for our support for mental health. You know, tell us how to do this. We're working in, for example, in Gilgit-Baltistan, which is a northern part of Pakistan, which is very underserved and under-resourced. And we get requests from there to do something for mental health in GB, which to me is, it makes me very proud that we have not only started and built something, but that we are also recognized for it.
That's really nice. So what are a few challenges that IRD has faced over the last few years as it has grown?
I think all organizations have challenges. It would be obviously incorrect to say that we have not faced challenges. Sometimes we've had funding challenges where between grants. There's a funding gap. COVID obviously has taken a toll on everybody, personally and professionally. And so it's been a matter of making sure that employees are able to get through that. I think one of the challenges that we will always face as we grow is just to be able to sustain our growth. And I think for companies that grow at the scale at which we have, it is a problem that is being addressed. But leadership is very aware of this at every level, and leadership is very forward thinking to always be able to see 10, 15, 20 years down the line and take the necessary steps that are needed to be able to ensure that IRD is a strong organization, even larger than it is now, 20 years from now, as opposed to having to close and downscale. So I think that just making sure that we're able to maintain our strength and our growth um, will always be something that we need to deal with.
So what is your goal for both IRD and your role in IRD over the next 5 to 10 years?
Oh, I can talk about IRD first. As I said, I think IRD is, I hope, and our goal for IRD is that it continues to grow, that we continue to innovate and come up with new ideas. And the way to do that is to bring in the best talent that there is, fresh, young, new ideas, people such as yourself, who go and who study and are really interested in issues around them and want to make a difference, people who are passionate. So the goal for IRD is to continue to be an organization with a reputation that attracts people to it, and then just give the space to people to shine and do what it is that they want to do, and that will make us grow. It has in the past, and I have no doubt that it will in the future. As for my goal at IRD, I love the organization. I love being here, and I love everything that IRD has given to me. So I would just hope that in the next 5, 10 years, I'm able to continue to be in a position where I'm able to give back just as much in whatever role that may be. But I would want to continue to contribute to the goals and the aims of IRD.
That's really nice. So could you tell us about a few projects that you're currently working on?
Yeah, sure. So of course, in mental health, we are doing in partnership with Queen Mary University and partners in India. We are working on an RCT that is looking at improving the healthcare provider and patient interaction, the better quality interaction for especially patients with psychosis. We're also doing very interesting and exciting work in community engagement, working with caregivers and families of people with psychosis, using arts and using theater as a way to have more meaningful engagement. We have integrated the mental health program within many disease areas. So TB is something we've worked with in the past, but also now, as I said, COVID, we've integrated mental health services in the same way that I had described. We're ensuring that we're able to contact trace as well, people, which is not a concept that is very easily understood in Pakistan. And we're looking to move into the spaces of adolescent health. One of the big focuses of the mental health program in the last 2 years has been integrating mental health within primary care in Pakistan. Again, something that is not being done at scale in Pakistan at all. So we're very proud of the fact that we have done it, and we have done it at scale, and we're looking to grow that work in the future. We've done it in Karachi, and we're looking to move into the province and throughout the country. Again, people, usually the first point of contact for healthcare issues is at the primary care level. And if we can, our aim, our vision is that if we can integrate mental health at that point, if people walking in from their homes to the community centers or community doctors for physical health can also have a mental health screen, we'd be able to address many issues before they become very, very severe. We'd be able to address issues upstream before they reach a point where psychiatric or medicinal care is required. So that's for the mental health program. Within IRD, we have a very large maternal and child health portfolio. We're working on ensuring that families and homes where there are under-immunized or never immunized children are accessed and provided immunizations so that young children are protected as they grow older. So we've done some really interesting work around that, and we're expanding and scaling up that work as well. We've worked with HIV in Larkana, especially where the HIV outbreak happened, as you may have heard. And so we've worked with those families and those children. We worked on addressing stigma, getting communities involved, and advocacy. And so these are some of the major programs that we're working on, and we're always interested in moving into new areas. In the past, we've worked very closely with youth and youth engagement, where we work with young women who are between the ages of, between grades 9 and 12. And we talk about public health issues, we talk about issues that impact them, because these young girls will go on to become mothers and have their own families and be key decision makers for their own health, but also their family's health. So we've had very large programs where we have engaged them for better health.
Super amazing and very innovative, I must say. So on a more personal level, Aneeta, when you're not working, what do you enjoy doing for fun?
Um, I'm trying to think of when I have the time to have fun. But I've got two young children, and with COVID and with dealing with homeschooling, most of my time outside of work is really dealt with trying to make sure that they are nourished and they are mentally and physically stimulated and their work is done and so on. So a lot of it is really just spent on spending time with them. I would love to be able to move back into sports and so on, but at this time, really, it's just work and the kids for me.
That's really nice. So what tips do you have for others who would like to work in similar kind of settings?
I think that it is critically important to find your passion. I know it sounds very cliched, but I think that that is what will keep driving people to just stay and stick with one thing. Often in the younger generation, there's people get bored, and then they want to move on. In our parents' generation, in the older generation, people would stay in one job for 30, 40 years and be very proud of it. But in our generation, and even the generation that's younger now that is stepping into their careers, there is often, there's a thing about we're going to try different things, we're going to move around. And so I think and that's completely fine and that's great. But I think that when you finally decide on what it is that you want to do, make sure it's your passion. And then I think it's also don't be afraid to take risks. I think that's something that I've learned. Often we think so much about making it right and making it perfect that it's paralysis through analysis. And so we kind of tend to do that, and a lot of people aren't able to move and actually try things. And I think it would be really great to just give it a shot. It might fail, and that's perfectly fine. It's okay. Even if you fall flat on your face, it's going to be fine, because you will learn and get up from there and go on to do big things. And so I think those two things are really important, I think, as tips for young people who want to step into the space.
Thank you so much, Aneeta, for giving us your time. And it was lovely having you here and learning about your journey and IRD.
Thank you so much, Minaya. Thank you for this. It was lovely speaking with you.